Hello, this is Matt Rauen of the Wolfe Eye Clinic. The purpose of this video is to introduce laser cataract surgery utilizing LenSx technology. This is a technology which utilizes a femtosecond laser to perform critical steps of the cataract surgery procedure. It is a technology that we've been using for some of our cataract surgery patients since May of 2012. For some time, many patients have thought that their cataract surgery was performed with a laser. It hasn't been until recent developments that this was actually the case. You'll see this is the docking of the laser, and on the left side of the screen we see engagement by the suction cone to the surface of the eye. This allows the eye to be held still during this initial portion of the procedure. The pink line there is outlining what is the planned capsulorhexis size, and in this particular case it measures 4.9 millimeters in diameter. On the upper right side of the screen we see an OCT image of the anterior capsule, and utilizing advanced imaging, the laser starts planning out a portion of the procedure for us, and we either accept what we are presented or we can make adjustments, as you see here in the upper right image. The purpose of this portion of the procedure is to make relaxing incisions within the cornea to correct astigmatism. So now on the left side of the screen you'll see the beginning of the actual procedure, and you can see the white lines indicating an incision made by the laser within the anterior capsule of the lens. You can also see liberation of air bubbles, and next you will see creation of the arcuate incisions to treat this patient's astigmatism. The patient then is moved to our operating room, and in this case standard cataract surgery is performed. The laser can also be used to create the corneal incisions that we're doing in this case with a blade. It can also be used to soften the lens material. At this point we're introducing viscoelastic to maintain space within the anterior chamber of the eye, and we're going to create the main incision where the phacoemulsification probe will be introduced. As you can see in this portion of the video, a cystotome is used to gently confirm that we have a continuous capsulorhexis. Occasionally little tags in the peripheral extent will be detected, and we're just being extra careful here to make sure everything is perfect. But as you can imagine, that circular opening that is created within the lens capsule is much more precise than the human hand can provide. We're now separating the lens from its capsular attachments, and we do this with gentle fluid waves. Some users of the LenSx technology have described some differences in cortical aspiration. So in this case we're being extra careful to make sure we have roughened up the peripheral cortex. We're even using a Chag cannula here subincisionally to add more BSS than we would typically use. We then introduce the phacoemulsification probe, which is used to aspirate the lens material. In this particular case we're going to use our typical phaco chop, but again this laser technology can also be used for this portion of the procedure to soften the lens material before it's removed. In this particular case we chose not to utilize that. So we break the lens material up to many pie-shaped sections, and we'll one by one aspirate these out. We're then left with the epinuclear shell, which also is aspirated by the phaco probe. Again, in our hands, we have found that the most advantageous use of the laser seems to be the creation of that opening within the lens, the capsulorhexis. Additionally, the arcuate incisions are incredibly precise and reproducible. In this particular case, we'll also use some hydration of the cortical material. Again, some users have felt that this portion of the procedure seems a bit different from our standard cataract surgery. We're using a silicone tip here. I've found this is very forgiving in aspirating cortical material, and to be honest, we haven't detected a tremendous amount of difference in cortical removal. However, you do maybe have to go a little bit more peripherally, simply because the femtosecond laser does not generate the typical cortical tags that we're often used to. In this case, we'll also gently sweep this last remaining portion of the cortex to the subincisional area. And I'll sometimes do this removal of this after the IOL is implanted. This is a Terry squeegee used to perform final polishing of the posterior capsule. I put this directly on the viscoelastic cannula. And this is introduction of a single piece acrylic intraocular lens. The Lester hook is used to rotate it into its proper orientation. I typically like to have the haptics oriented at 6 and 12, and in this case that's going to facilitate removal of that last remaining cortex. And we're removing that right now. At this point, the lens has been centered, and we'll hydrate the corneal wounds. And then the last portion of the procedure, we'll turn our attention to the arcuate incisions, which again are going to help this patient's astigmatism. We're using a blunt-ended instrument to open these up, which is a very easy process. Occasionally we'll leave these closed, but in this particular case we decided to open them. And here's the final result, and this patient did very well. Thank you for your attention.